around tuberculosis. One of the issues is around children who catch tuberculosis. Dr. Karen du Preez is at the Desmond Tutu TB Center, also at the Department of Pediatrics and Child Health at the University of Stellenbosch. Doctor, good afternoon to you, and thank you for your time this afternoon. How serious a problem is childhood tuberculosis in our country at the moment?
Hi, Stephen. Thank you very much to talk to you. So children really has suffer major from TB. Globally, the World Health Organization estimates that 1.2 million children developed TB in 2018. TB is also still one of the top causes of mortality in under 5 children. And I think what's concerning is of the 1.2 million children with TB worldwide, we know that roughly only half of them are diagnosed and reported through TB programs. In other words, half of the children with TB worldwide were not diagnosed, didn't start treatment and weren't reported.
One of the problems we've had during the time of COVID-19 is that some children with the disease are not being diagnosed. As a result, we're missing children who've actually contracted tuberculosis during this time.
Yes, that's correct. But I do think that the problem has been with us even before COVID-19, because some of my research in 2018 already showed us that roughly about a third of the children in South Africa were not diagnosed or treated. So we, in South Africa in 2018, we treated and reported roughly 17,500 children. So it's really a big problem for us as well. But the World Health Organization estimated that we had a caseload of about 27,000 children. So close to 10,000 children in 2018, and that was before COVID-19, were not diagnosed or diagnosed but not reported within the TB program. And obviously with COVID-19, things did not get gotten any better.
I mean, how difficult is it to treat a child with tuberculosis? I mean, usually it requires a lot of pills. The treatment takes a long time, obviously, depending on the type of tuberculosis that you have. Is it any different for children? Does it take as long?
Yes, so children also still at the moment receive 6 months of treatment, but at least we're working towards child-friendly formulations, which would be one sort of tablet that they can take and if it's resolved. So the good news is that most children who are treated actually do really well. So if we can diagnose the disease early and we treat them, the majority of them do really well and they don't have any residual health problems after TB. The problem is that we need to get them to diagnosis. And then once they're diagnosed, make sure they continue care, they access treatment, and they continue treatment.
Dr. du Preez, I'm going to ask you to stay with us. I'm going to introduce now Cindy Blazier from the Positive Women's Network. She's also a part of this conversation this afternoon. Cindy, good afternoon to you, and I do appreciate your time. One of the things you've been looking at is particularly women who are living with HIV who contract tuberculosis. That's a difficult enough situation to be in, although I know you can cure TB if you're living with HIV. But throw in the COVID-19 crisis on top of that. That must make it very difficult for women in this situation to get the diagnosis, the treatment that they need. Cindy Blazier, I don't know if you're with us.
I did not get. Yes.
Right, I'm going to just going to sort out that connection. We're going to bang whichever box needs to be banged so that we get a clearer line to you, Cindy Blazier. I do apologize for that. Dr. du Preez, I mean, when we look at children who are in these situations, they seem to be falling through the gaps during this time of COVID-19. Do we need to go on a concerted effort now to try and make sure that we find the children who are vulnerable to this disease?
For sure, and I think the first step towards getting there...
I'm so sorry, but the audio is very bad. I cannot hear.
Sorry, is to accurately measure how many children sort of go through what we call the cascade of care. So ideally every child with TB needs to follow several steps in order to be successfully treated. So they need to present to health services, they need to be diagnosed, then they need to be treated, they need to be reported to the TB program, they need to complete the 6 months of treatment. And obviously, we don't know how many children go through this cascade or where they're actually lost. it really limits our ability to respond to the epidemic. So I think that's a crucial first part of tackling the epidemic in children.
Is it getting easier at all to treat children with TB? I mean, are the treatments improving? I know they are for adults in some circumstances.
Yes, and there's exciting research that was shared a while ago that even shorter regimens for children with minimal disease, they do really well. So things are definitely getting better. I think the challenges are more to actually identify the children, get them diagnosed, get them onto treatment, and then supporting them through the treatment journey. One of the things that we've seen with children specifically is that they're often diagnosed in hospital. So they're referred from primary health care clinics, they come to hospital, and we've seen large numbers of children with TB at all tertiary and district hospitals in Cape Town, where they've been diagnosed, started on treatment and referred back to the community health centers to complete their treatment. And it's very important that the data from the hospitals, for instance, are also fed into our surveillance data so that we can have actionable data, so that we can really see where children are lost. Certainly in Cape Town, we knew that some of our children were lost between discharge from hospital and actually accessing care at the clinic. And through an intervention, we could really improve that and close that gap. And I think that's where the power of data and accurate data along the care cascade comes from, because it allows you to respond effectively to where the gaps are.
Dr. Karen du Preez, thank you. At the Desmond Tutu TB Center, also at the Department of Pediatrics and Child Health at the University of Stellenbosch. I do appreciate the time.